Hi, everybody. Just a little bit of technical things I'll take care of now. Thanks so much for coming to this discussion of Chinese medical nutrition. I appreciate your interest in this, especially usually a neglected topic in Chinese medicine. So today we're going to get started by looking at historical perspectives for Chinese medical nutrition. What I'm hoping is that as we go through historical perspectives of Chinese medicine, that this gives us a little bit of confidence to prescribe Chinese medical nutrition in the modern clinic. And also what I'm hoping is when we go through these historical perspectives, that you can notice that Chinese medical nutrition has really enjoyed an elevated status in Chinese medicine throughout the centuries. So as we go through those brief historical perspectives, I hope you notice those two things and get some inspiration to prescribe in the modern clinic. And then after that, we'll look at real briefly Chinese medicine versus nutrition, Chinese medicine nutrition versus Western nutrition. We'll compare and contrast those a little bit. And then we'll begin constructing a really simple two-aspect framework for prescribing Chinese medical nutrition in your clinic. Then we'll look at functional cooking methods and their effect on the quality of foods. And then after that, we'll look at resources for prescribing Chinese medicine nutrition, including using your new app. And so if you signed up for the class early, you should have an app with you. Excuse me, if you signed up really recently, including today, that I know a bunch of people just signed up today, my assistant Stephanie will be in touch with you and get you an app. Okay, and then finally, if there's time, then we will, excuse me just for a sec. Finally, if there's time at the end, I have a couple of case studies queued up too, so we can just kind of look at the nitty-gritty for prescribing Chinese medical nutrition. Okay, and then also I won't be able to look at the chat. So if there's anything you really want to discuss at points during the talk, I will pause and ask for you to unmute and talk, but unfortunately I won't be able to look at the chat right now. So let's go ahead and get started then with these historical perspectives. Okay. So as early as the Zhou dynasty, starting in the 11th century BCE, the emperor had 18 medical officers under him. And then you notice right here too, the top two advisors for the emperor, they were specialists in dietary medicine. And then below that, they had people that were just, general physicians, and then below that, the surgeons. But right away, as far back into the historical record as we can get, these for Chinese medical nutrition was elevated to the highest status for the emperor. Okay, Sun Song Miao here in the Tang dynasty, he had this to say: people who practice medicine must first thoroughly understand the source of the disorder and know what has been violated. Then use food to treat it, and if food will not cure it, afterwards apply herbal medicine. So this is maybe one of our most famous herbalists in the history of Chinese medicine, recommending food first before going to medicine. So again, like I was saying before, this the elevated status that Chinese medical nutrition is really enjoyed over the centuries. And then here's Zhi Chen in the 11th century. Experts at curing diseases are inferior to specialists who warn against diseases. Experts in the use of medicines are inferior to those who recommend proper diet. So again, kind of echoing several centuries later, what Sun Song Miao had to say, right? Again, we always are looking to, before disease becomes really significant, right, to nip it in the bud. And then same thing with food too, right? If we can use food before we use medicine, then that's, again, just an easier way for the body to recover itself. All right, so what I'm hoping is that by the end of the day today, you'll be able to answer this question a little bit better. This question here, is asparagus good for you? We'll look at going forward why, as Chinese medicine practitioners, we actually can't answer this question: is asparagus good for you? And I'm hoping as we go through this discussion today, you'll see why. Okay, so let's look at Western nutrition. My background is my undergraduate degree is in food science, and so I worked in the Western side of things for a little while. And from the Western nutrition side, it's a little bit, it's so new that it tends to really swing wildly back and forth. You know, whatever the latest research tells them to do, they really swing wildly. This is a heavier. They're really focused on macronutrients and macronutrient ratios, right? Carbohydrates, proteins, and fats, and the ratios in the food. That's really how they classify food. It's unpersonalized, right? They just these macronutrients are really these are really healthy diets for people based on the macronutrients. You remember low-fat diets, right? That was recommended for everyone. Low-fat diet, focusing on that macronutrient. Currently, low carbohydrate is really popular with Western nutrition. I guarantee the next trend to come through will be low protein diets. That's a guarantee because that's the last macronutrient that hasn't had a trend yet. So Western nutrition, again, just really starting to get their feet under them to make dietary recommendations, really focused on the macronutrients. Excuse me. Chinese medicine nutrition, on the other hand, takes into account the current diagnosis of the patient. Each individual food for Chinese medicine, it has its own qualities, its own unique qualities. So we're not interested in macronutrient ratios. We're really interested in individual foods and what those individual foods bring when they go into the human body. And then also food prep method, right? How that food's prepared will have a big impact on the qualities of the food. And then temporal consideration, something Western nutrition, at least, you know, when I was there studying food science, we never ever considered, you know, people should have this type of food in the winter and this type of food in the summer. That was just the furthest thing from our minds. So anyways, this is just a little brief overview from Western and Chinese. And then this is a great quote from Wendell Berry, and unfortunately, this is really true. People are fed by the food industry, which pays no attention to health, and this is absolutely true. You know, when I was making, large quantities of food in the food industry, right? We never really thought about what that food was going to do to the health of the consumer, right? It just never crossed our minds. We were, the closest thing we got to health, we just want to make sure the food didn't have any botulism in it or anything like that. So unfortunately, yes, people are fed by the food industry. We had no interest in the health. We were really interested in the price point for the food and the packaging. Was it pretty or not, or something like that, but not actually what that food was going to do to the health of the consumer. And then unfortunately, this is often true too. People are treated by the health industry, which pays no attention to food. I was able to ask the head of one of the oncology departments at UCSF near my home, what kind of dietary recommendations does he make for his patients, for his oncology patients? And he said he's just unable to make any dietary recommendations. And so for me, this is unfortunately, again, from the Western nutrition side, right? There's not a really good stable place. It's just swinging kind of wildly from study to study to try and decide, and it's unpersonalized. And so that's really, we're really fortunate with Chinese medical nutrition. It really enjoys a lot of really important, benefits, the opposite of the benefits. We can really personalize things. So this is what I was alluding to before with the asparagus question, right? So if you ask a question, is asparagus good for you? I really understood this framework when I was going to Chinese medical school. In the afternoon, I was in San Francisco. In the afternoons, I would go and intern for Dr. Angela Wu in San Francisco. And she was a really busy clinician. She would see 60 patients a day. And so when I would go there, I'd just help her out to do anything she needed, moxa, cupping, do intakes and things like that, walk her dog if needed. And in return too, she would let me ask her questions. And I was really shy, so I wouldn't ask her very many questions. But one day in the morning, we were studying individual herbs. In the afternoon, when I went to Dr. Wu's clinic, I forget what herb it was, but say it's Wu Weizi. And so I studied that in the morning at school and then went to see Dr. Wu in the afternoon. And I said to Dr. Wu, again, she's real busy running around so many patients and things like that. Somehow I got the courage up to ask her. And I said, Dr. Wu, is Wu Wei Zi a good herb? And Dr. Wu was furious. I'll never forget, this was 20 years ago. I'll never forget this in my life. She turned on her heel and said to me, for who, when? And then this really, it was this a really turning point for my understanding of what Chinese medicine is, right? Yes, we have to have this framework. We can't say Wu Wei Zi is a good herb. We always have to ask for who, when. Is asparagus a good food? We always ask for who, when. Is this a good acupuncture point? For who, when, right? And it just, it's a really simple framework, but this has really guided my dietary recommendations ever since, right? We always have to ask for whom and when. So let's explore this a little bit, and let's look at this whom first. All right, this is from Xu Dachun. There's a beautiful quote from him. If a physician is brilliant in his considerations and perfect in his skills, he will adapt his treatment to the individual circumstances of each illness. And since the circumstance of an illness may vary 1,000-fold, he will establish 10,000 different therapeutic patterns. So this is how, for Chinese medicine, this is how we diagnose. We put the patient into a pattern dynamic, right? And that pattern dynamic determines how we're going to treat them.